Hello, everyone. I'm Erin Vignay, Director of Clinical Affairs for AMDA, the Society for Post-Acute and Long-Term Care Medicine. On behalf of AMDA's Behavioral and Mental Health Advisory Council, I welcome you to this third webinar of our Healing Together series. Please take a moment now to make sure your microphone is muted so we can minimize any background noise. We encourage you to use the chat function to ask questions and respond to any questions from our speakers. And now it is my pleasure to introduce you to our presenter, Mr. Francois Beausoleil. He is the co-founder and lead trainer of the Empathic Leadership Institute and trains, coaches, and supports individuals and organizations throughout the world. Francois specializes in teaching empathic leadership, empathic coaching, and nonviolent communication. He is highly skilled at helping participants discover and transcend internal and external barriers so that they can live from a more fully empowered state. Francois' previous career was as a musician with the Cirque du Soleil. He brings creativity and music into the rooms and hearts wherever he shares his work. He has an MBA from Sherbrooke University in Quebec, Canada, is a certified trainer with the Center for Nonviolent Communication, and a registered corporate coach. He is also the author of the ebook, The Blame-Free State, published in 2014. And without further ado, Francois, thank you for joining us today.
All right, you're welcome. It's great to be here. Thanks, Erin. And so the topic for the call, just to clarify, is really how to increase compassion, resiliency, and moral wellness in post-acute and long-term care settings. So we'll be looking at how to bring more empathy in the work settings that you're a part of. And as a way to introduce the topic, I want to tell you a little bit of a story of something that happened to me now about 15 years ago. So at the time, there was an important event, which was the 50th wedding anniversary of my parents. So kind of a big deal. And my parents live in Quebec City, and I was living in Sherbrooke, which is a couple of hours drive. So I pack my stuff with my wife and my son, and we go to Quebec City. We take a room in the local university. And then in the morning, I tell Anya, my wife, I say, hey, Anya, I'm gonna run some errands. Would you call me on my cellular at 11:30? So she said, yeah, I'll call you. I'll call you on your cellular. Then I said, at what time you're gonna call me? I just want to make sure there's no misunderstanding. She said, yeah, 9:30. I got it. And I mean, 11:30. I got it. I'm going to call you, right? So I get in my car, I do my errands, and at 11:30, my phone's not ringing. And I wait a little, but 11:40, 11:45, the phone is still not ringing, and I start to get upset. I start to get impatient, and my thoughts start to move towards some version of blame. Like, how could you do that today of all day? Like, it's a big day, it's a big thing happening. And I mean, we were clear on the time, like, and then the blame keeps growing. And at noon, the phone still hasn't ring. So I'm now borderline angry. I mean, I can't believe it. Like, you had only one thing to do. And I sort of forgot that she was taking care of my son, which was not an easy thing at the time. But I'm angry. And then that's when I remember to maybe do a practice what I preach. So I looked in my tools of tricks around empathy, and I picked one, which is to try to come up with a scenario that would lead me to have as little blame as possible for the person I'm feeling blameful towards, in this case, my wife. So I'm trying. So what could be a scenario that would help me decrease my blame? And I'm trying hard. I'm like, maybe she didn't find the phone. But I mean, it's like it's impossible. There's a room, there's a bed, there's a phone. She has eyes that can see the phone. So it's impossible. But then it hit me. Maybe she had a problem with the calling card. because in these days, when you were not in the city where you live, you needed to have a calling card to do a long distance. It in a weird way, it was a long distance from the university to my cellular. So I'm thinking maybe she had a problem with the calling card. And it sort of made sense because I remember that we had some problems with that calling card, the card that I knew she had. So it all made sense. But the net result is that I'm calm. But notice I don't have a clue what's going on for her. But still I'm calm, and that's the goal of asking myself that question. So I continue my errands. I go to the university there and I see my wife. I say, hey, did you have a problem with the calling card? She said, yes, are you okay? I just tried to call you, but the calling card didn't work. I even tried to go to buy a card, but there's no stores here, and you had the car. Are you okay? And let me tell you, I was so happy that I used this trick. Because imagine if I would come and just scream at her and tell her, "You didn't call me. That's the only thing you had to do," and we agreed, and she would get defensive, and we would get in an argument, and this could be the thing that might ruin the whole party. So that's my introduction to our topic, which is how to infuse empathy in our stressful times. And I'd like to invite some of you to reflect on this, and please write on the chat, what have you seen ways in which I introduced some empathy in that stressful situation? So, what were the ingredients that led me to have access to some empathy in that stressful situation? Please put your responses in the chat. And I'll put the question here to make it easier. So how did I manage to infuse empathy in this stressful situation? All right, so Jim, thanks, Jim. You tried to identify with another person. You gave them grace. Yeah, I gave them the benefit of the doubt. It was hard because I was so wanting to blame her. Some curiosity about our experience. Absolutely. That's the essence of empathy. Then thinking about could have prevented her from calling. And these are the things that I'm not saying it's easy to do. I'm saying that this is part of what can drastically change situations, and this is what we'll be looking at for this evening, because really I'm going to share 5 best practices to infuse empathy in stressful situations. And the principle that this whole best practices is based on is that empathic responses are much more likely to bring connection between people, which could lead to some collaborative outcome, something that works for everyone. On the other hand, non-empathic responses do the opposite. It's likely to bring some disconnection, it's less likely that there will be some connection, therefore less likely to have a collaborative outcome. So also, I believe that we are all wired for empathy and collaboration. This is in us. So when we have the capacity to do so, that's what we'll do. We'll choose an empathic response. Now, we don't always have the capacity, and that's why I'm bringing these 5 best practices. And I want to welcome now Dr. Jim Wright, who is going to help me with this through this call. Jim is a medical director and chair of the ethics committee. Hello, Jim. Thanks a lot for being here.
Hi, Francois. Thanks for inviting me.
You're welcome. So would you share in a couple of minutes, how important is empathy in your role?
Well, I'm actually a professional empathizer. It is my job to empathize. I
Uh,
don't think I would still have a job as a medical director or as a geriatrician in long-term care without practicing and becoming proficient at empathy. So super important.
right. Thank you. Very clear. Without it, you wouldn't be where you are, and so
Right.
obviously you take that very, very seriously, and it's very important to you. Great. So we'll build on that. Anything you want to add, Jim?
Well, I would say that it is definitely a skill. Like you point out, there are techniques uh, and tools that you have to use to be a good empathizer. It is oftentimes not natural because as a physician, as a person that lives outside of long-term care, you really have to work hard to identify with people that are differently abled and certainly have cognitive issues. And it's not a natural, easy thing to empathize with your patients who may see a different reality, may be having delusions, and may certainly, as is often the case, may be focusing on things that in your view have little to do with their health or their stay at your facility. So
Right.
so that's hard. I can say I'm better at it now, 25 years into my practice, than I was at the beginning. That's for sure.
Right. Thank you. Lots of important keywords there. Once it is a skill. So part of it is to upgrade our skills, and sometimes we reach the maximum of our skill level. So then it's often, okay, come back to drawing board. And, okay, how can I deal with this situation now? And it seems this is what's been going on for you through the years. And yes, definitely, it's not an easy thing. Although we are wired for it, there's a lot of complexity. There's a lot of things that make it harder for us to access that. So
Mhm.
thanks a lot,
Mhm.
Jim. Um, I want to talk briefly about a survey that we sent a couple of days ago. So thank you so much to the people who answered the survey. It was really, really helpful. And we're going to send you the detailed report of what came out of that survey. But the main thing I wanted to verify is that, and that's actually came true through the survey, is that when people have time to reflect, in the vast majority of occasions, they will choose an empathic response. That's really what came out of that survey. People choose responses to stressful situations that are infused with empathy when they have time to reflect on it. And that was part of my reflection that led to these 5 best practices. So let's dive in with the first one. And so, simply put, the first best practice to help us bring empathy in difficult, stressful situations is to refrain from bringing a non-empathic response. That's the first step. So, of course, we need to identify them. So, I'll share my screen to give you a sense of what they are. So, you can see here there's a list of 14 non-empathic responses. And I just want to put it in context for you and ask Jim to help me with that. So, Jimmy, imagine that you're as a medical provider, you're meeting a resident who's unhappy because there's some staff who are not vaccinated. So,
Mhm.
what could be something that they would tell you? Just give me a sentence, and then I'll demonstrate what not to do. I'll demonstrate non-empathic
Mhm.
responses.
Mhm. Well, I think a common response from a patient would be, "Why are you putting my health at risk? I've been in the hospital. I'm in a critical stage of my health, and you could be giving me COVID here in this facility."
Thank you. So if I start with giving advice, I would say, look, um, really what I suggest is to just trust us, right? We know what we're doing. We're on it. That would be giving advice. Diagnosing would be, a bit rougher. Say, look, the problem with you is that you're always picking on what's not working. There's so many things working well. Why are you picking on this, right? Storytelling would be, you know what? That reminds me, 3 years ago, I was working in a facility and there was a staff member who came who was dressed differently and blah, blah, blah. I could start telling my own story. Next thing would be pity or sympathy. It would say, oh, poor you. Oh my God, this is terrible. I can't believe this is happening to you. So sympathy or pity is also non-empathic response. Or I could reassure, say, look, it's going to be fine. It's going to be all right. We're working on it. Or shut down would be, yeah, we know. Right? Or changing the subject would be, yeah, thanks. And how about the food? Is the food better these days? Interrogating would be, so how many people did you see being unvaccinated? How many times did they come to you? How often does that happen? So just bunch of questions. Feeding the fire is making it like worse. It's like, oh my God, are you telling me that there's unvaccinated staff that are near to you? This is incredible, totally unacceptable. So you make it even worse. One-upping would be to say, that's nothing. You should have seen what happened in my other venue, right? And then you tell what's been kind of worse than this situation. And the others arguing, being right, defending, justifying, or minimizing or exaggerating are the main non-empathic responses. And I want to check with you, Jim, does that make sense to you? Can you relate to that first best practice to refrain from bringing any of these responses?
It does make sense. I guess I'm a little curious about the sympathy not being an empathic response.
So both with sympathy and feeding the fire, there is some part of it which is empathy. If I'm there for you and all of this, you'll have a sense of being understood, right? But it's called a non-empathic response because the focus is on me. Like it's really on my own emotions. Oh my God, this is unbelievable. Like poor you. So it detracts the focus from the speaker.
Mm-hmm.
And sometimes we refer to it as some kind of low-grade empathy, but there's still some empathy.
Mm-hmm.
Same thing with feeding the fire. You give a sense that you understand, but you make it so big that you're actually not fully connected to what the person said. Does that make sense, Jim?
Yeah, that does make sense. I mean, I think feeding the fire is a big, it is something I've been guilty of in the past. And like I said, developing the tools over the past couple of decades, I realize how harmful it can be to fan the flames.
Right. All right. So clear for you. That makes sense to you to refrain.
It does.
From these responses as a first step. And the principle, the empathic leadership principle that we use to help us remember this is connection before solution. And so the timing is really, really important. If you want to come up with any collaborative solution, if there's no human connection before that, it's going to be much harder. And it doesn't have to take a lot of time. Some studies that came out recently, if you're curious about the book called Compassionomics, they found out that sometimes just with 40 seconds of compassion, it drastically changes the level of connection and trust in a conversation. So connection before solution. So now let's move to the second best practice. So it's actually the alternative to a non-empathic responses. So it's an empathic response. So I'll talk a little bit about it before, and then I'll bring the screen again. I'll share my screen again after. So an empathic response is one where we bring an intention to be present to the other person and give them a sense, give them an experience of being heard and understood. Without that intention, it's not going to work. It's not going to happen because, as Jim said, it's not easy. We are not trained for that. We're used to operate in different ways. A lot of people around us don't go to that place. Non-empathic responses are all over the place in movies and TV shows, and honestly, they're all around the world. I've been lucky enough to travel to at least 15 countries, and it's everywhere. So it will require some specific intentionality, which is to be there, give an experience of being heard and understood. So let's now sort of demonstrate this one again with your help, Jim. So I'll just demonstrate it first, and I'll explain the mechanics. So let's imagine that you are staff who is close to or in burnout, and you would come to me as a medical provider. Then I'll demonstrate empathic responses.
I've just been asked to work a double again, and I worked a double last weekend. I've got a life outside of this place. I'm fed up with how the administration keeps, working us until we're almost dead, and I can't take it anymore. I'm ready to leave.
All right. Well, thank you for sharing. And I just want to make sure I get what you're saying. So it seems like you've been asked for a double recently, and then for another double on top of that. And of course, it makes sense. You have a life outside of working here, and it sounds like you're in a place where it's too much. You can't handle this. It's like too hard for you.
It is. I got a family. This is just too much. I'm going to quit.
Right. So at this point, looking at all things and the priority, like your family, is of course a really high priority for you. Is what you're seeing as an option is just to quit. And I'm guessing this is actually probably really stressful for you, and just probably brings a lot of frustration because you've been working. You've been working hard here, you've been giving everything you have, and now you're sort of in a position where the only option that seems to make sense is to quit. Does that capture your experience? Yeah.
Plenty of other places hiring, that's for sure.
Right. That's definitely that's not a problem. And I'm guessing that's what's important to you about this situation is to be understood about the complexity that you're going through, and to be more than understood, to have some specific actions taken by us to make your work easier and make it kind of doable to do your job. Is that something like that?
Exactly. Yeah, we need more people.
Right. So action, concrete steps, bringing more people in, because this is untenable for you right now. Yeah.
Right.
Okay. All right, so it's a demonstration of a combination of two types of empathic responses. One is an empathic reflection, where I sort of reflect what I heard just to check if I understand and also give you a sense of being heard. And another one is empathic guessing, when I guess what are the emotions that are present for you, and I guess what's important to you. So let me check with you, Jim. How was that to be on the receiving end of that?
Yeah, I felt like you were listening, that I was heard, that I had an ally potentially.
Right, great. So those are the key elements that are part of empathic responses, to give a sense of being heard, and then build some trust that there's some ways in which you could have some support. I'm guessing this would trigger maybe just a little bit of hope that there's something could change. Maybe not a lot, but maybe a little, as opposed to any of these non-empathic responses. Yes?
Right. Yeah.
All right, great. Yeah. So I'll share my screen again to explain the mechanics of this one. So where is it here? So as I said, there's two types: reflection, guessing. So empathic reflection aims at giving a sense of being heard. in a non-judgmental way. And it also involves asking if what you understood is accurate. There's two parts. And empathic guessing is focusing on feelings and need, and it helps the person to go a bit deeper in terms of clarifying what's going on for them. The principle here is, as you can see, understanding doesn't mean agreeing. And that's a big deal for a lot of people. Think if I empathize, it means that I agree with what the person said. And sometimes, like Jim was talking about, when the people's worldview is so different than yours, you certainly don't want to say anything that would give us an idea that you agree with it. So that's something to remember. And again, I want to check with you, Jim, in your experience, how can you relate to this best practice and to this principle?
Well, yeah, I think it's something I do practice regularly. It is super important to understand what you're talking about, first of all. And I think, you know, in a lot of the situations that we find ourselves in as PALTC providers is, you know, trying to gain some clarity about what exactly the issue is. So that reflection and that time spent in trying to figure out what is the underlying issue is super important. You know, so for example, if you have somebody, this is pretty frequent, somebody with dementia that you know, is asking where their mother is, for example, and this is a 90-year-old with dementia, asking where their mother is, you have to try to figure out whether they miss their mother in particular, or are they worried that no one knows where they are? Are they worried about, you know, being abandoned? And so you have to kind of try to figure out, you know, what is the issue, and you know, if it is a solvable issue, because obviously that's what you want to do as a provider. So so yeah, finding that underlying reason or rationale behind the concern is really important.
Thanks so much. It's such a fantastic example that proves that it's worth the time. It's worth slowing down and be a bit curious, because now you know more what's going on. And also the person has a sense of being heard. And being heard is really, really, really important for a lot of people. So it can reduce the emotionality as well. And again, lead to something more productive. So great.
Right. I've got a funny thing that just happened to me a couple of days ago. This patient with dementia that's on our skilled unit, she sits out in her doorway and she calls to people as they walk past, and oftentimes people are in a hurry and they'll walk past sometimes without even saying anything. And I recognized this, and I came up to her and I spent some time with her talking, you know, trying to engage with her. And after about a couple of minutes, she says, I'm a little, you know, she said, I think you should move on now. You're getting suspicious. You're spending too much time with me. So, so I had to move on before she got more suspicious. So.
Oh my God, that's so interesting.
Too much
Thanks,
attention.
thanks, Jim, for sharing. So moving on to the third best practice. So one of the main things that's going to stop us from being able to be empathic is reactivity. So this is the way that our brain is designed. When we detect a threat, our brain is likely to move into a defense mode and bring some of these defensive mechanisms, like mostly known as fight, flight, or freeze. But basically, our prefrontal cortex goes kind of offline. It's really hard to think clearly. So then imagine going to a place of empathy. It's almost physiologically impossible. So then, therefore, it's something else to look at very, very importantly. And the best practice is simple but not easy, but it is to pause when we start to get reactive. We need to have some time to come back to our senses, to bring our attention to the prefrontal cortex, so we can actually do something that makes sense So how we're teaching to do this, which, like I said, simple but not easy, is through a concept called above and below the line. And I'll share my screen again to tell you how that works. So how we what we found to be really helpful for our students, people we work with, and ourselves is to imagine that there's a line of choice. And when you're below that line, you are reactive, which means that you are not choosing how you respond to the situation. It's on autopilot or just an automatic response. And again, our brain is designed for us to do things without thinking, just to protect ourselves when we detect a threat. So, it goes fast. It just goes really, really quickly. So when it's automatic, it's called below the line. When we're choosing our response, it's called above the line. And I want to run you through, Jim, a series of questions for you to experiment with this three-step process to see if there's something that could help you and potentially other people. So the scenario here would be that as a medical director or medical staff, you would be interacting with the visitors who might be unwilling to mask up or display aggressive words or actions, right? So they come in, you're there, and that's what's going on. And so I'll just run you through the step to just demonstrate and explore at the same time. So the first step is to notice and describe the emotional and physical cues that let you know that you're getting reactive. So let's start with the physical cues. What might be happening if you portray yourself in that situation, like physical sensations?
Well, internally, it would be anger. Most definitely. It would be alarm that someone is coming in, potentially harming or even killing my residents. Externally, I'm sure I'd be a little flushed in the face, and I'd have a difficult time maintaining a neutral appearance, a professional appearance. And I'd certainly have a hard time practicing, probably would not be my best in practicing empathy, because in our world, this is not dissimilar to any other situation where a person with a weapon is entering a public space. I can't see much difference. There's someone that's coming in that potentially has a deadly disease that's refusing to take precautions. So it's like someone's carrying a gun into your facility. So it rises to the level of something that maybe is, in my view, very hard to practice empathy, and perhaps that takes a back seat to security.
Right,
Really.
right. So thank you, and thank you for putting things in perspective. At least for me, like it's equivalent to someone coming in with a weapon,
Mm-hmm.
and it just tells me the incredibly high level of tension and stress that people in the medical field, especially in nursing homes, are living with. And just want to share just a lot of compassion. And it was really helpful the way you just phrased it, Jim. So in terms of that step, you like emotionally would be anger, frustration. Physically would be, you said, like flush in the face. Maybe part of it would be a heartbeat going faster, and then it's hard for you to stay composed, right? And that's really the first step, is to be aware, notice these cues, so you can have the message, oh, I'm getting reactive. And if I'm not careful, I'm actually going to lose my ability to really choose what to do next, right?
Mhm.
And that second step is really about this. So if you, again, imagine you're in that situation, if you focus only just on one thing, which is staying above the line, which means choose the next thing you're going to do or say. What is the first thing that makes sense for you to do? Just thinking about choosing, not going on autopilot.
Right. Well, I would say what's worked for me in the past is making sure that I provide people with a choice, actually. I mean, I think what doesn't work is giving people ultimatums with no choices, right? So I'm pretty good at trying to give people at least the feeling that they have a decision that they can make, whether that decision is simply, I know you want to visit your loved one. We have rules here to protect both your loved one and everyone else. If you want to do that, we have some things that you'll need to do. If you don't want to do that, then we'll have to pick another time and another setting for you to
Right.
visit. So rather than saying, you cannot come in here like this, how dare you put my patients at risk, turn around and leave, that's not something I would do, although I would want to. So I would probably try to find a way to present it as a choice to them.
Fantastic. Right. So if you focus on choosing a response, you will go with giving them some sense of a choice. And the phrasing you used was, to me, kind of very elegant and powerful. And there was some empathy in there, actually. I know you want to see your loved ones, so you understand a bit what's going on for them. So
Mhm.
awesome. So the third step would be for you to check with we call it the higher self for shorthand. So it's to connect with the highest wisdom available to you. Like I firmly believe that all of us, we have this part of us that just knows what's the best thing to do, not just for you, not just for that person, but for the whole. So if you're able to connect with that higher wisdom, what might come up to you? Something else that might help you to deal with that situation and
Yeah.
reduce your reactivity.
Well, I mean, I do try to practice love and grace. That that is my, from my faith background and my philosophy, that is my go-to. Recognizing that I do have a good, healthy dose of the exact opposite in my personality. I actually have, quite a temper, and I've had trouble controlling it all my life. But I've lived long enough now that I realize that, you know I will sometimes say to myself, this is a child of God,
Right.
say to my, just subconsciously or under my breath, child of God, child of God. And so recognizing some kinship with the other person, recognizing value in that other person by virtue of that, and then understanding that my role as a fellow human being, a fellow creature of God, is to extend love and grace. So I would say that would be my aspiration, that
Right.
higher self that I aspire to,
Right.
and
Awesome.
sometimes achieve.
Right. All of this is not something we can do all the time for sure, but when we're able to do it, can make a big difference. So for you, when you connect with your higher self, it goes to that place of your value, like the love and grace, and the language you use to help you is, this is a child of God. So great, awesome. Um, just to check with you, it sounds like that you can relate to the steps, something it seems like you've been doing, but just tell me a bit more about how you relate to now this framework of three steps.
Um, guess I've been probably practicing that. Yeah, I think I do. I think the beginning of an empathic response to me in this situation, this is kind of a critical situation. It's not unlike a code. We frequently, unfortunately, respond to people having sudden cardiac arrest in the nursing home. And I remember in my training, the number one thing you're supposed to do when responding to a code is check your own pulse. Make sure that you're under control. And I'm pretty good at controlling emotions and trying not to show them. And I think we've talked before, Francois, about compartmentalization. So
Right.
being able to get those emotions in another place that doesn't color your interaction. Now that's been very hard for me, but I think that's I like that as being the number one criteria for an empathic response here. Is if you let emotions color your decisions, it will probably be the wrong decision in this kind of situation.
Okay. All right. So the principle makes sense to you. All right. Thank you. So now the fourth best practice is the next challenge that's gonna make it harder for most people. It makes it harder for most people is our tendency to blame. This is a lot of the work I've been doing as I start to learn about personal growth and personal development. A lot of my life was tainted by blame. I was sharing with you, Jim, my first career was as a musician. We did tons of things like touring. I was even with Cirque du Soleil for 5 years. So there's lots of stuff, but so much blame around that it killed a lot of the fun of doing all that. So I see blame as the number one thing that damages relationship, the number one thing that kills collaboration. So it's a pretty big deal. And it's all over the place. So the fourth of these best practice is to identify and reduce the blame that we have for others. Even if we reduce it by 2, 3, 5, 10%, it's likely to have an impact and allow us to show up in the way that we want to show up. And so I'll share my screen again. So for this fourth best practice, decreasing blame, there's also a 4-step sequence. And again, want to explore that with you, Jim. So this time you would be, as a medical director, you would be interacting with the staff who does not want to get vaccinated. And to make it maybe even worse if that's possible, that staff already told you that they would do it, you're counting on it, and they sort of come back to you and say, no, actually, I'm not going to do it. So put yourself in that situation, and then I'll run you through the steps to see just how that works for you and demonstrate this best practice. So the first thing is to identify in the blurry of emotions and thoughts, what is emotionally painful for the other in this situation. So get out of the internal chaos and zoom into what is painful for that person.
For the
emotionally.
Right, for the employee that's refusing to get vaccinated.
Correct.
Yeah, I emotionally painful. My guess is that it would be a person that's coming from a tradition of not trusting the medical community, and all of a sudden being forced to do so. And so I imagine it would be fear-inducing to take that step and to accept an injection of a liquid that you have no real idea about and no trust in the people that put that liquid together. So I think
Okay.
fear would be the main factor.
Great. Thank you. So, and what's emotionally painful is to sort of be forced. I mean, it could be the case,
Feeling
like
of being out of control and right.
out of control. And then the emotional experience would be the fear. There's a lot of fear about something that is to them unknown. And because there's been this history of not trusting either government or medical authorities, then there's a lot of fear around it. So great, that's really all that's needed for that step. And actually, I think I don't want to minimize it. I think it's a great movement of the heart towards seeing someone else's humanity. So thank you for that. So the next thing is, what is your best guess of what matters the most to the other person in this situation?
Mm-hmm. Really maintaining the integrity of their body and control of their body. Determining, it's autonomy. It's been able to determine what is done to you and with you.
Right. So as you inquire, you think about what's going on for that person, what's important to them, something about their body, the integrity, plus the autonomy we talked about, some sense of control and choice. So that's perfect. It's exactly what we want to zoom in that step. And can you relate even just a little bit to what matters to them? You relate to that, like wanting to protect the integrity of your body, even if you disagree with their decision. Can you relate to it even just a little?
I certainly can relate to autonomy. Can I relate to autonomy in this situation? Maybe a little,
Right.
maybe.
And really, that little to me is important. There's 1% in which you can see the human person struggling, and that's gonna dictate a lot of your own emotional responses, how you're gonna approach it. It's gonna impact your level of stress. It's gonna impact your ability to move past that situation and feel more at peace. So to me, that's important.
Mm-hmm.
And the last thing would be, and you touched on this before, and this is what I was sharing in my story at the beginning, like, what can I tell myself that would help decrease the level of blame I have for this person?
Mm-hmm.
So what could you tell yourself? So really the goal is to decrease the blame, because we know that blame is actually pretty dangerous in terms of what it's going to lead us to in terms of decisions. So what could you tell yourself?
Well, I would have to say nothing works for me really well other than I am very loyal to family and friends. And if I can establish this person, if I can turn this person into a family member or a friend, that would help. So again, it's that that mantra almost of looking at people as a fellow brother or sister, a child of God, I guess, is probably the only way that I can do that. And I'm thinking particularly of a very chilling moment in the pandemic. I had gone through a terrible experience in the spring of 2020, but in the winter when we all were suffering, my other facility that had been free of COVID had finally, the shoe dropped, and we had our pandemic, our epidemic in one of my other facilities, and I was there standing next to the worker who brought COVID into the building.
Oh my God.
We had a patient that turned up positive, and so everyone got tested according to the guidelines. And I was standing next to the CNA who had been working with him for the past week, and she said, "Oh yeah, I've had a cold for the past 4 days, and I just didn't tell anyone about it." And she said it to me, just sitting right there. And of course, she was the one aide that was positive for COVID. and 12 people died. So it was really hard after that to see her in the hallways, and I still do. And we're friendly. She looks up to me and respects me. I had a hard time respecting her after that. I had a hard time, being in the same building with her. But I have to recognize some level of kinship with her. So I think, and I've gotten past that to a degree. Obviously not all the way, but so I don't think I could have continued to work with her had I not seen her as a fellow human being, a sister, someone who's finding their own way, or trying to, so somehow I was able to forgive.
Right.
When I think I would have had a hard time doing that otherwise. So
thank you. So touching. Because I'm just hearing you just touching in the magnitude of the grief that was present for you as you noticed the impact of that person's choice that led to the tragic death of 12 people, and just touching into it is very it's very moving. And it's also moving to hear you speak to how important it is to, even in these circumstances, to reach out, try to find a parcel of humanity and kinship. So thanks so much, Jim.
Sure.
Okay, and so just to wrap this up, the last best practice, and we're not going to go in depth because of the time we're at now, but it's to create some empathic support structures. So I believe that the extent of how we receive empathy will determine how much we're able to give to other people. It's like a tank. You can think of that as an oxygen tank. Like, we need to fill our tank of empathy to be able to use that, to tap into it. And like I said, this is likely to bring to much more collaborative outcomes and much more peace of mind most of the time. So when we have structures in place, we don't have to reach out. We don't have to ask constantly people, oh, can you help me? I'm struggling. You have a 10-minute schedule here. You have an half an hour. So it's happening. So the structure of support is so important. And I know that there's not a lot of time in this work. And so it's almost like take advantage of what's already available. Like for example, it could be in stand-up meetings, in shift changes, in care conferences, in interdisciplinary team meetings. Just a little bit of a place where in the culture would allow some space for people to be heard and not responded with non-empathic responses, and responded with just that level of care and space for their experience. So I'll share my screen so it's easier for people to see, to maybe just to remember that next best practice. So creating empathic support structures. The key questions is, do I have the empathic support structure to get through the current challenges? And how can I tap into social resilience? So the idea of social resilience, that when you're maxed out with your individual resilience, the only option really is not to tough it out, is to enlist other people at least a little bit. Doesn't have to be a lot, but you'll get a lot just of engaging with someone in a safe way. And again, curious to hear your thoughts on this, Jim. Does that make sense to you?
Oh yeah. I mean, you've got to have other people to help you through this. We talked earlier, I was fortunate enough to have we have 4 kids, and 3 of them were either working or at college, and otherwise gone from the house. But during COVID, college was basically canceled. They were doing online stuff, and my oldest daughter office was closed. So all the kids were back home. So we were really fortunate to have the kids back home during the worst of the pandemic. And I could come home to a big family at the end of the day. I have another physician who's a medical director that I've known for a good 20 years, and we talk regularly about our experience. He's a medical director in other facilities in another part of the state. Super, super important to be able to just unload and you know, so that's 2 groups. I have one group that has nothing to do with medicine, and that's fantastic, and you don't have to talk about medicine. Then I have another group where you can just kind of talk about the specifics and get those off your plate also.
Great. Thanks a lot. I'm glad to know it resonates with you as well, Jim. So now we'll move to a period of question and answers for maybe 5-10 minutes. So questions to either me or Jim or both. So Aaron, would you sort of facilitate that part, or I'll just help me with finding some questions that might be already there?
Sure. So far, we just have some comments. So I invite anyone who has some questions or comments to please put them in the chat in these last few minutes.
All right, thank you.
And I'll take this opportunity to thank you both for a wonderful discussion, and to thank Dr. Wright for his openness and honesty for this as well. Thank you.
Yeah, you're welcome. So far the comments is, I agree. Yeah, someone.
I was just going to remind everyone, someone just asked, will we get a printout? The recording of this webinar will be posted on our website at paltc.org. If you put in Healing Together, we have a landing page that has the archived recordings. And then also Francois has sent me some other materials that we'll post as well up there too. And those should be up there by tomorrow. We have a question from Paige Hector. What would be the first thing for staff to do to establish empathy practices and to bring this new communication language into their work setting?
Okay, all right. So let's hear briefly from both of us. I think the first thing would be to know what to do in terms of practices, and I think these 5 best practices might be the place to start. It could be something else, but one thing to start with, and then create a structure. So if what you want is close to what Jim said, like if you want a place to express what's going on and be just listened to, so that's the first step. You could find someone else and say, hey, would you be up for spending 10 minutes every lunch break? 5 minutes I share what's going on, you listen, and in 5 minutes you listen. And then you take it from there, and you can sort of add other ways to do it. Maybe you'll bring a 3rd person at some point, maybe another. It's going to grow from there. This is just my thought for now. Jim, what would be your response to that?
Yeah, I guess I think, you know, I'm just trying to think what's practical in a very busy, you know, overburdened long-term care setting. And I think, again, you have to establish some sort of kinship between people in order to just, you know, mount an interest in even empathizing. You know, you have to be interested enough in the person, and to do that, you have to know them. So, right, you could meet and talk with them, or you could build some kind of you know, kinship around a certain project or a certain outcome, but you do have to be, you know, a tribe together in some way in order to be interested in empathizing. So how you build that, there's many ways, but I guess that's the question.
Right. Thank you.
We have another good question from Cheryl, who asked, what is the best way to repair an emotional reaction that may have damaged the connection? So you may have responded in the wrong way.
I'm sorry. Saying I'm sorry, you know, and then you know, practicing forgiveness and showing that, you know, that you were wrong and you're willing to you know, repair. I think you know, obviously the first step to repairing any broken connection is to at least express your regret.
Right, absolutely, exactly where I was going. The first step would be to come to the person and say, look, I realize I'm just totally not happy with what I told you the other day, and I just like to talk about it. Do you have a couple of minutes, right? Already the person is likely to be open, even if they're upset. Then after that would be to bring a little bit of empathic reflection. Say, look, I'm guessing after I talked to you, you got really upset, probably frustrated, and maybe just disappointed in me because this is not what you expected from me. And just guessing you were counting much more openness and much more support from me. So is it something like this that was going on for you? And then it's likely that the person would tell you yes, and there's this other thing, and then you can also, yeah, reflect. Yeah, I know, I get it. This was also very discouraging as you're struggling with this and this and that. Thank you. I really get it. And then the next step is the regrets, the mourning. So say, I just want you to know, I'm really sad. I'm really regret not having been able to be there for you when you needed me. Just saying it, I get emotional. I get touched just by the words, right? So I'm really regretting I was not able to. I know you were in trouble, just to give a hand, like be there and help you in that struggle. And then have a bit of an empathic back and forth. That's what I've seen the most effective. But you've got to be ready to receive some blame that's going to come at you. It's not likely to be all that easy. But if you're ready to hear some blame, take it in, reflect it. It actually might work.
And Swati Gar noted tensions are very high among registered nurses in long-term care and staff.
Right.
They're working they're short-staffed and working nonstop. What are some practical things that we can do to kind of help with that tension?
Start with you, Jim.
Oh gosh, yeah. I mean, you know, everyone's overworked. You've got to show appreciation. And how best do you show appreciation? You know, someone should write a book called Beyond Pizza, right? Because you can buy pizza for lunch and for breaks, but you've got to find out how people feel appreciated, you know, and there's that book called The Seven Love Languages. And for some people, it's gifts, for some people, it's this and that. But, you know, really the number one love language for staff is money. And so, you know, we all have experienced in travel nurses coming into your facility, filling up spaces, and the amount that they get per hour is incredible. But they're like the happiest nurses. So they don't feel overworked. They don't feel underappreciated. So it's really kind of simple. How do you keep people going? You know, when you have unavoidable staff shortages, you appreciate them through money, or you appreciate them through not admitting new patients, or, you know, you put the money on the line. And that, you know, I think is the number one thing that lets people know that a business, a facility appreciates what they're doing. So maybe that's a simplistic answer, but I think it works.
Thank you. That makes sense from my angle. When there's tensions between people, it's close to the repair. But the first step that I've seen as powerful is to take responsibility. Takes courage, but once you do it and say, look, we screwed up. we didn't anticipate well. And yes, this is what came out of it. That usually the intensity kind of drops already there. And then to share a plan, something that makes sense. So look, here's what we have in mind to do, and then to take some actions, follow through. Because if you don't follow through, it might be really hard to build or to maintain the trust that you're having. But to me, taking responsibility is what can really help unlock tensions. Of course, it's not easy, but that's something that I've seen working well.
Wonderful, thank you. It looks like that's the comments, all the comments we have and questions for now, which is perfect timing since we're just a few minutes over. Did you have any last words you want to share with us?
Well, I just want to extend a warm thank you to Jim. I'm so delighted to have been receiving your support, and how you responded and how you navigated this was just like a pure delight. So thank you so much. And thanks to Aaron and everyone who organized it. Thanks to Paige, who was a really important actor in making this happen. So I'm just filled with gratitude at this point. Jim, anything you want to say?
Oh, I guess the only thing I would add as far as how to make it through this pandemic with, yourself intact and your ability to empathize is make sure you show grace and forgiveness to yourself as well. Be kind to yourself. Give yourself some slack, and get some sleep.
All right.
Great
Awesome.
advice.
Perfect. Great final words. All right. So thank you, everyone.
Thank you so much.
Bye for now.
Thanks, everyone, for joining us. We'll see you next month on November 18th. This time we're moving it to 6 o'clock, so don't be late, 6 p.m. Eastern. We'll be joined by Lori Porter from the National Association of Certified Health Assistants, and she's going to bring some CNAs along to talk about how our leadership can better work with CNAs. So we'll see you all in November. And again, thank you so much, Francois. It was wonderful. Have a good night.
Welcome.
Bye-bye, everyone.
Yeah.
Good night.
Bye-bye.
Bye-bye.